For 5 minutes.
Mr. Speaker, I rise to recognize an event of critical importance to all current and future childbearing families in this country. For 3 days in October, a national summit of maternity care stakeholders met in Warrenton, Virginia, to discuss the status of home birth within the greater context of maternity care in the United States. That meeting marked the first time a multidisciplinary group of maternity care providers, consumers, and industry leaders came together to determine what the U.S. maternity care system could do to make home birth the safest and most positive experience possible for moms and babies. Given the significant controversy over the appropriateness of home birth within the groups represented at the summit, the fact that this conversation took place at all is historic. The goal of the meeting was not to debate the rightness or wrongness of home birth, but rather to discuss the support, care, consultation, collaboration, and referrals necessary to protect moms and babies in all birth settings. According to CDC's most recent figures, in 2008, approximately 28,500 home births took place in the United States. While this number represents less than 1% of all births in our country, the last available statistics tell us that between 2004 and 2008, the number of women giving birth at home increased by 22%. Without compromising quality of care, women want and expect to have choices for childbirth, including birth setting. Women and families are ill-served when maternity care professionals allow conflict between disciplines to supersede collaboration. The safety of birth in all settings must be the utmost priority. The delegates who met in Virginia were charged with finding common ground to move the issue of safe home birth beyond professional differences and toward consensus building. The result of their effort was a consensus document released in November 1st of this year. This important document sets out 9 essential statements of agreement about the ideal system to promote the safest and most positive birth outcomes across all birth settings. While I will be submitting the entire document into the record, I want to highlight the following key points agreed upon by all the delegates at the summit. First, all childbearing women in all maternity care settings should receive respectful, women-centered care, including opportunities for shared decision-making to help each woman make the choices that are right for her. Second, physiological birth is valuable for women, babies, families, and society, and appropriate intervention should be based on the best available evidence to achieve optimal outcomes for mothers and babies. Third, collaboration within an integrated maternity care system is essential for optimal outcomes. And when necessary, all women and families planning a birth center at home have a right to a respectful, safe, and seamless consultation, referral, transport, and transfer of care. Fourth, all health professionals who provide maternity care in all settings should have a license that is based on national certification that includes defined competencies and standards for education and practice. And fifth, in order to foster effective communication and collaboration across all maternity disciplines, all students and practitioners involved in maternity and newborn care must learn about each other's disciplines and maternity care in all settings. Additionally, the consensus document calls for medical liability system reform, a compulsory process for the collection of patient data into all birth settings, the elimination of disparities of care, and increased consumer participation. The Home Birth Consensus Summit document is an important first step in protecting and supporting all childbearing families across all birth settings. But the discussion must not stop there. I encourage all professional organizations representing providers of maternity care and newborn care and all childbirth advocacy groups to affirm the consensus statement and commit to working together towards its realization. Mothers and babies in this country deserve nothing less. I yield back the balance of my time.
Gentlelady yields back. The chair